Severe itching in pregnancy happens for several reasons. And it also depends on the area where this itching is happening. Okay, you can see this woman says she is 6 months pregnant and she is having severe itching. If this itching is happening in your vaginal area or your genital area, it could be an indication for yeast infection, bacterial infection, irritation from the soap you're using, or other causes. If it is happening on your belly area, your thigh, your breast, and your skin, it could be as a result of stretching. As the pregnancy is going, the whole body is stretching, and this causes dryness and itching as well. Okay, if this itching is happening on the sole of your feet and the palm of your hands, it could be suggesting what we call intrahepatic cholestasis of pregnancy, okay, a condition that affects the liver. I advise you to let your healthcare provider know if you're having any discomfort in pregnancy. This is one of the reasons why you register for antenatal, okay? Instead of going to tell people that will advise you to use hot water to bathe. Now, if this itching is happening on your skin, hot water can only give it a temporary relief. And this hot water worsens that itching because it causes the skin to dry more and it can even irritate the skin. Instead, you should do this. Use cool or lukewarm water to shower, okay? And after that, you can use a natural oil, non-scented oil, to just moisturize your skin and your belly, that area where that itching is happening. If this itching is happening in your vagina, you need to stop using scented products in your vagina. Stop every vaginal wash you're using. Stop every bubble bath. You need to stop them. Hair loose, breathable cotton on this, all right? And you see that area where that itching is happening, keep it dry. And stop scratching. When you scratch that area, the more it can worsen the situation. It can even leave you with bruises. All right? Like I said, go and tell your healthcare provider right now that this is what is happening to you so they can help you. Immediate actions you should apply when your child suffers an electric shock. Electric shock should be treated as an emergency, either electric shock from household appliances or war outlet. First thing you should do, you should safely separate that child from the electric source. Now, separating the child from the electric source doesn't mean you should go and touch your baby. No. These are ways you can safely separate that baby from the electric source. Number one, turn off the power supply, the main power source, turn it off. If you cannot safely turn that off, you can do this. You can get a wooden object, okay, and separate your baby from the electric source. Wooden object like either a wooden stick, it should be dry, a wooden broom, okay. You can also step on a dry blanket, okay, with your wooden stick and safely separate that baby from the electric source. Please do not use anything wet. Don't use water. Don't use anything mental. Okay, use non-conducive, some things that cannot cause an electric shock when you use them, like wooden stuff, and it should be dry. All right. Now, when you have safely separated this child from the electric source, move that child away and observe your child. Look at your child. Observe if that child is conscious, if the child is breathing, if there is any burns on anywhere. If the child is not conscious, the child is not breathing, please, while you scream for help, commence CPR. While you're doing CPR, tell people to assist you to get a vehicle that can convey you and your child to the hospital. While you're going to the hospital, on your way to the hospital, still continue doing CPR on that child, okay? If you don't know what CPR is, just tell me in the video. I'm going to do a video for that, all right? Even if the child appears to be fine after the electric shock, please still take that child to the hospital, because sometimes electric shock can actually cause an internal injury or some abnormal heart rhythm that may not be visible immediately that shock happened. Okay, so still take that child to the hospital for the child to be observed, to be evaluated by a healthcare provider. All right.